Okay. Hello, students. Am I live? Am I audible, guys? Hello. Okay, fine. So we have this. Good evening, everyone. So I'm Dr. Murugan. I teach PSM here. So we are here in this session on this INI-CET exam. We have this session INI-CET exam, and we have 2 days. One is today, and we have tomorrow session. So we'll see some important, some 25 questions today. Tomorrow we will see some 25 concepts tomorrow. Okay. Hope this is clear, and we will start the questions. You please post the answers. We will discuss it. We'll try to keep it simple. We will try to discuss it. At the end of that session, I will post on this PDF format. Whatever we are writing, I will give it in the form of PDF. Okay. Hope this is fine. Okay. Good evening. What is the answer for this question, guys? What is the answer? First question. Regarding rabies immunoglobulin, which of the following statement is or are correct? Okay, fine. So first let us see something related with rabies immunoglobulin. So for any case of dog bite or any wild animal bite, we are going to use it for category 3 bites. Okay, for category 3 bites we are going to use. Category 2, category 3 we are going to use vaccine plus immunoglobulin. Category 2 bites we are going to use only vaccine. Okay, fine. Vaccine. We are going to use only vaccine. What is the answer for this question? Okay. First, let us see the immunoglobulins. First, let us see. So, immunoglobulins. If you take the immunoglobulins, so we have these 2 types of immunoglobulins available. One is human. Second one is equine, horse immunoglobulin. Okay. So, human, it is 20 international units per kg, and equine it is 40 international units per kg. Based on weight you have to give. So what you have to do is that you have to provide, okay, so basically you can give human or equine, but what is available in our most of the government hospitals is they will be providing equine immunoglobulin, equine. So half the dose. So you have to provide half at the half dose at the site of the bite. Site of the bite. So remaining half dose at some IM region you can give. Okay. So around the wound you have to give at the site of bite. Remaining half you can give it at other site as a IM you have to give. Okay, fine. Now, so look at the question and tell me what is the answer. Okay, what is the answer? We'll go one by one. So if we'll go first statement, not used after 72 hours. Ideally, it should be given with as early as possible, but it can be given up to 7 days. Not more than 7 days. You should not give more than 7 days. Okay, fine. So first statement is wrong. Maximum dose in deltoid area, no. So you have to provide at the site. Okay, maximum you have to provide the site of the bite. Dose to 20 international units per kg. This is a right statement, and that is human immunoglobulin. Equine means 40. So if there is no human immunoglobulin present, then you can give equine immunoglobulin. So both options are right here. Okay, so both are right here. 2 options are right. Okay, multiple options. So 2 options are right here. Okay, fine. Now, so am I clear? Some additional points we will see. Some additional points we will see here. Some additional points. First is what is the schedule for vaccine? What is the schedule we have? So if it is intramuscular regimen, it is 0, 3, 7, 14 and 28 days. Okay, post exposure. We are talking post exposure. Okay. So if it is intradermal regimen, okay, that is updated thigh regimen, So if you are going to give, so intramuscular means 0.5 ml, intradermal means 0.1 ml. So it is given 0, 3, 7 and 28 days. Okay, this is post exposure. We are talking post exposure. Now, the recently asked question, there was one dog bite was there. Patient came to hospital with a dog bite, but dog is vaccinated. It's an AIMS question, INI exam question only. Dog is vaccinated. What you have to do? Okay, irrespective of dog vaccination. Okay, so what you are supposed to do is that you have to vaccinate the individual. Vaccinate the individual. It's a recent question. So recently you had 1 or 2 questions. This is one such question. Okay, so irrespective of dog vaccination, you have to vaccinate the individual. One. Second, what is the case fatality rate of rabies? We are doing all these things to prevent rabies. Come on, you can post it in the live chat. What is the case fatality rate? Case fatality is the only condition you are having. Case fatality rate of 100%. 100% case fatality rate is there. Fine. So irrespective of dog vaccination, you can vaccinate the individual, guys. Fine. Okay. We'll go to the next question. We will go. If you want pre-exposure prophylaxis, some points related with pre-exposure prophylaxis. Okay, pre-exposure prophylaxis. So I don't think there is lag is not there, doctor. Okay, it's working fine. Pre-exposure prophylaxis 0, 7, 21 or 28 days. Pre-exposure prophylaxis. Okay, if you want to give already vaccinated, post-exposure already vaccinated, the person is already vaccinated means you can give 0-3 days. Okay, 0-3 days. Okay, fine. The question is related with immunoglobulins, which you can answer it, guys. Immunoglobulin, you can answer it. Okay, 0-3 days is post-exposure already vaccinated. Fine. We'll go to the next question. What is the answer for this question? Can you answer it? Yes. Study design of choice for a circadian variation of fat content in expressed milk of mothers of preterm infants. Okay, fine. In nutshell, we will see all the study design. You tell me what is the answer. First, in India, we follow intradermal regimen. Government hospital, we follow intradermal regimen. We will follow. Private hospitals, intradermal is not possible. So in a private setup, we will follow mostly intramuscular regimen. Government hospitals are intradermal only. This is the regimen we follow in government hospitals. This is the regimen we follow. Government hospitals. Okay, because the dose, number of dose is less actually. Okay, so, but you have to provide every time 2 sites. You have to provide every time 2 sites. 2 sites you have to provide every time. So if you are giving the right arm, you have to give it in the left arm also. Both sides you have to give. But in spite of that, the dose is actually less. Yes. Okay. So we'll see the study design of choice for testing circadian variation of fat content. So we'll start here. Various study designs you will see. What is cross-sectional study? What is cross-sectional study? Cross-sectional study means I am doing a study on only one group and we are having to find out prevalence, we do it. So usually you will have one-time contact with participant. One-time contact with participant. Right? That is cross-sectional study. Okay, so today you go somewhere, you check their blood pressure only one time. That is cross-sectional study. We have one more study is there, longitudinal study. Longitudinal study, more than one contacts, only one group, more than one contact with the participant. Okay, fine. So you go to a place, you identify a group of people, you follow them, check their blood pressure over a period of 1 year, 3 times, 4 times you check, then it becomes longitudinal study. So only one time contact cross-sectional study, more than one contact is longitudinal study. Okay, right? Now, what is this case control study? Okay, case control study. A case control study where this is the population, you select cases and controls, then you ask their exposure status. Okay, so that is why it's going back in time. It's going back in time from outcome to exposure. That is a case control study, outcome to exposure. Okay, fine. Now, the second one is cohort study. Fourth one is cohort study. Okay, for cohort study, it's exposure to outcome. Okay, it is exposure to outcome. Okay, so you have two groups are there. So one is exposed people, second is non-exposed. Okay, non-exposed, and you follow them. How many of them are developing outcome? Okay, so you take example, any example you take, smoking. Okay, smokers, non-smokers, you check how many of them are developing bladder cancer or lung cancer. Okay, so that is cohort study. So exposure to outcome. Case control study is outcome to exposure. Okay, now we'll go back to the question. You answer me what is possible here. Okay, fine. Study design of choice. Okay, so one more is there, RCT. RCT means we are going to do intervention. We are going to do intervention. We are going to do retrospective cohort study. We will see. We'll see retrospective cohort study. So retrospective cohort study, I am doing the study in 2023. Okay, so I identified one batch, suppose 2000 cohort. Cohort means group of people with common characteristics. So I am doing the study in 2023. I go back in time. From the cohort, I divide people into two groups, exposed and non-exposed, and currently checking their outcome. Okay, so cohort study means it's exposure to outcome only, but in retrospective cohort study, I am going back in time. This is the retrospective cohort study. Okay, cohort study, I am going back in time, but I am starting with exposure to outcome. Okay, I am repeating again. The retrospective cohort study. Cohort means exposure to outcome. Retrospective cohort study, even though I am going back in time, but I am starting with exposure to outcome. Okay, fine. Now we will go back here. We will see what is the answer here. Study design of choice for testing circadian variation. You can put the answers, guys, okay, in the chat box. Circadian variation of fat content, okay, in expressed milk of mothers of preterm infants. What can be done here? Can we do a case control study? Can we do a cross-sectional study? Okay. Prospective cohort means what first we discussed, that is a regular cohort. Prospective, retrospective. Okay, look here. This is what? So this answer for this is, we can go with the prospective cohort study. Okay, fine. Prospective cohort study means I can take two types of mothers. Mothers with preterm infants. Okay, mothers with normal infants. Okay, over a period of time, I am collecting their breast milk, expressed breast milk. The question is expressed breast milk for fat content. Okay, so expressed milk. Okay, I am collecting here. Here also I am collecting here. And I am checking how many percentage of mothers having more amount of fat content. Okay, so the only possible answer, okay, we can do this study is prospective cohort study. Okay, so case control study you can't do it. Cross sectional study only one time, that is also not possible. Okay, so only way we can do this one is prospective cohort study. Hope this is clear. Somebody put it in the chat box. Are you able to follow this? Fine. Next. Third question. Which among the following vaccines will be administered early? Every exam, the important topics usually for a INI exam is you will get more amount of questions from biostatistics, and nowadays it has become less actually. biostatistics, epidemiology, screening. These are the concept based topics. Then you will get from vaccines, usually vaccines, diseases, communicable disease of public health importance we will get. Okay, some other topics are the MCH, demography, 1 or 2 questions from nutrition. Okay, but these are the areas and programs. These are the areas maximum number of questions used to come. Okay, fine. Now, which are the following vaccines will be administered early? So you tell me which are the following vaccines. National immunization schedule. Can you tell me which are the vaccines we give earliest? We don't give meningococcal vaccine, the national immunization schedule. Okay, so we give this rotavirus as the early one. Diphtheria, toxoid, no. Varicella zoster vaccine we don't give here. So what we give is that at birth, you all know that BCG, OPV 0 dose, Hep B we give. This is birth. 6, 10, 14 weeks. Okay, we give all these vaccines. 6 weeks we give rotavirus, pentavalent. Okay, we give OPV. Okay, along with IPV, along with pneumococcal. Okay, 10 weeks we don't give IPV and pneumococcal. All 3 remaining vaccines will give. 14 weeks we give. All 5 vaccines will give. What are the 5 vaccines? Pentavalent, IPV, Rota, okay, pneumococcal and OPV. These are the 5 vaccines. At 9 months, you'll give 9 completed months. MR, JE will give. MR, JE will give along with vitamin A. Booster dose of pneumococcal. Booster dose of pneumococcal. Now the guideline says that if the question is very updated question, even IPV there is a booster dose will give at 9 months. The question very specifically says this is a INI exam and they are talking about updates. They are talking about updates, so we have to be updated. Okay, so if they ask you this way, this is the IPV booster dose. This we are giving at 9 months. Okay, now again 16 to 24 months, what we will give? Okay, MR2, JE2 will give, OPV will give. Okay, and DPT will give 16 to 24 months. 5 to 6 years, okay, will give DPT. This is also multiple times. This is asked 10 years, 16 years, pregnancy. At this time we'll give this DT, diphtheria and tetanus will give. Okay, these are the vaccines, guys. These are the vaccines. I'm just brushing it up. Okay, for your quick knowledge, I'm just giving it here. So 16 to 24 months, these are the vaccines. 5 to 6 years DPT, and this is DT. Okay, fine. These are the vaccines we give the national immunization schedule. Okay, fine. So the answer for this one is rotavirus, guys. Rotavirus. Other things we don't give it in the immunization schedule. Fine. The next question, guys. Next question. A 38-year-old male, female had 2 children named Kumar and Raj. One day Raj had fever along with rashes due to measles. After 3 days, Kumar also developed similar clinical features reported to sub-center. Okay, and they are asking which are the following is or are true. First, let us know some terminologies here. Okay, fine. What is the index case? What is the index case? Index case means what is a primary case? Primary case means first case in the community. Okay, primary case means first case in the community. It's a nice question actually. What is the index case? Index case means first case came to the health provider. Okay, came to the health provider. First case came to the health provider, right? Okay, fine. So this is one set of concept. And what is serial interval is there? Okay, serial interval. Serial interval is time between the first case and the second case. This time is called a serial interval, right? Now, what else we have to know? The question is related with measles, right? The question is related with measles. Now, can you tell me here in measles, what is the incubation period? What is the incubation period? So the incubation period for measles is 10 to 14 days, right? 10 days for fever, 14 days for rash. Okay, fine. Now, other thing what we need to know. We will see all these concepts, then we will go back to the question. What is the period of communicability? 4 days before and 4 days after rash. 4 days before the rash and 4 days after the rash. That is the period of communicability. Okay, fine. One more concept we need to know. Measles. Suppose an exposed child was brought to you. Exposed child was brought to you within how many days? Within 3 days. Within 3 days of exposure, okay, you can give vaccine can be given. Okay, vaccine can be given. 3 days. Within 3 days means vaccine can be given, right? Now we can prevent it. The disease incubation period is 10 days. Vaccine incubation period is 7 days. So if you have that 3-day gap is there. So if you are getting the child is brought to you earlier, you can give vaccine itself. Okay. Now we will go statement wise. We will go one by one. We will go. Fine. First, Kumar is an index case. Is it true or false? So what is the index case? Index case came to the health provider. Definitely Kumar is the person who went to the health provider. He reported in the sub center, right? So this is the right. Kumar is the index case. Okay, that is right. Second, Raj is the primary case. So only 2 children was there. So in that Raj was the first one to got the disease. So this is also right. Raj is the primary case. This is also right. Kumar got infected from Raj. Is it true or false? You go statement wise. Is it true or false? You can put the answer there. Kumar got infected from Raj. No, that is false, because after how many days Kumar developed? After 3 days. You require minimum what? 10 to 14 days gap is there. Okay. So Kumar got infected from Raj. That is wrong here. Wrong. If the mother had reported when Raj got infection, Kumar could have been vaccinated. Okay. So Kumar could have been vaccinated. But look here. So you require 7 days. Okay. Raj, after Raj, the child developed, Kumar developed disease within 3 days. But you require minimum of 7 days. Okay. If the mother reported also, Kumar got vaccinated, that is not going to help. This statement is also wrong. Okay. Am I clear? Okay. So Kumar does not get infection from Raj because the incubation period is 10 to 14 days. One. Second. Okay. If the mother reported Raj means we require what? Okay. Within 3 days. Okay. But within next 3 days the child got developed. Okay. So you require minimum of 7 days. So that statement is also wrong here. Hope this is clear. We'll go to the next question. Yes, we'll go to the next question. Question number 5. Are you able to follow? Fine. You can put it there in the chat box. Fine. 5th question. A 1-year-old child, male child, was brought to pediatric OPD for the purpose of vaccination. The first dose of DPT was given at 6 weeks. First dose. Okay. After birth, after that nothing was given. Okay, fine. What is the answer here? Okay, can you put that? Tell me the answer. Okay. So 2-3 points we need to know. Okay, because this scenario based question. The first point what we need to know is never restart the schedule. Okay, don't restart. Never restart. Okay, so you have to vaccinate for the age of the child. Vaccinate for the age of the child. So what will be the answer here? So you have to vaccinate. So if the first dose is given, okay, so then what you are supposed to do? Give the second dose. This is the key point here. Okay, fine. The next concept, okay, fine. Multiple times repeated question INI. So if you take the vaccines, which vaccines can be given at what age in the national immunization schedule? Okay, some vaccines up to 1 year. What are the vaccines that can be given up to 1 year? You should not give this vaccine more than 1 year. Okay, not more than 1 year. Okay, fine. One is BCG pentavalent, BCG pentavalent, IPV, Rota, okay, Rota, pneumococcal. Okay. So these are the vaccines. Okay, so you can give up to 1 year of age. BCG, pentavalent, IPV, and hepatitis B. Hepatitis B. Okay, so these are the 6 vaccines you have to give up to 1 year. Don't give this vaccine more than 1 year. Okay, fine. Next. Up to 5 years. 5 years you can give MR, OPV and vitamin A. MR, OPV and vitamin A. These vaccines you can give up to 5 years of age. Fine. Up to 7 years. Okay, DPT. This is, you can give DPT up to 7 years. Up to 15 years. Up to 15 years. You can give JE vaccine. JE vaccine. Okay. Keep this concept in mind. It's a concept based question. Same questions multiple times that has been asked. So up to 5 years and up to 7 years it is DPT, and up to 15 years you can give JE vaccine. JE vaccine. Fine. We'll go to the next question, guys. We'll go to the next question. Again a concept based question. Which of the following will not increase confidence interval? This is a question from biostatistics. Okay, so what is a confidence interval? What is a confidence interval? So whenever we are doing a research, okay, so suppose I am finding the prevalence of anemia, right? So in my research, I do my study in a sample. The prevalence of anemia is, let us say that 40%. Okay, for all the adolescents in a particular state or town we will take. I can't say that the whole population, the prevalence of anemia exactly 40%, I can't say. So what I will do is that I will give my result in the form of a range called as confidence interval. So what is this confidence interval? It is estimated range of values likely to include population's original value. So this is confidence interval. Okay, estimated range of values likely to include the population's original value. Usually what we do is that whenever we are doing a research, this is the population. You can't do the research in the entire population. So what you do is that you take a sample. So whatever results you are getting from the sample, you will try to extrapolate it. Okay, you will try to extrapolate. Okay, so when you are trying to extrapolate it, so you are going to use this confidence interval. So it's the estimated range of values likely to include population's original value. Okay, fine. Now, so the confidence interval we are going to write in the formula. So we have this 95% confidence interval, 90% confidence interval, we can say 99% confidence interval. So percentage wise I can tell. Okay, fine. So now, so for example, we will take one value 95% confidence interval. Let us take it for a quantitative data. Okay, so the formula for it is mean plus or minus 1.96 standard error. Okay, so 1.96 standard error. Okay, this is the formula. So what is the formula for standard error is? Standard error is standard deviation by square root of n. Standard deviation by square root of n, right? Now, more mathematical, but the concept is very simple. Okay, fine. Now, confidence interval and n. Okay, fine. Now we will see. N means sample size, guys. N means here sample size. One more terminology you need to know is what is variance based on the question. Variance means SD square. Variance means SD square. Okay. Now when the confidence interval will increase? When the confidence interval will increase? Okay. So, okay, confidence interval. Okay. If there is more, what is the relationship between sample size and the confidence interval? More the sample size. Okay. More the sample size means narrower the confidence interval. So it is indirectly proportional. Okay. So narrower the confidence interval. More the sample size, it is narrower the confidence interval. Okay. So let us assume that we will see the prevalence of anemia. Okay. So prevalence of anemia in one problem I will get 40 to 60%, 95% confidence interval. Okay, so in another condition it shows us 44 to 56. In another 95% confidence interval it is 48 to 52. Can you tell me in this which one is having more confidence, more sample size? That's what we want. This is the narrower I said. In which one, can you tell me in which one there is more sample size? Yes, this one has more sample size because narrower the confidence. More the sample size means less the chance of error. So error will come down. Standard error will come down. So automatically the confidence interval will be narrow. So if you take more the sample, okay, you do the study in 100 people, 500 people, 1000, 10,000. So more the number of people you select, the standard error will come down. Okay, so automatically narrower will become the confidence interval. Okay, this is the key point. Based on this we can say, okay, all others are we don't want. All others are we don't want. Which are the following will not increase the confidence interval? Okay, which are the following will increase the confidence interval? Decreasing the sample size will increase the confidence. All are will increase the confidence interval except increasing the sample size, okay, will decrease the confidence interval. It will make the confidence interval narrow. Okay, so increase in confidence level. Okay, if I confidence level, so 90%, 95%, 99%. Okay, so if I increase the confidence level, the confidence interval also will vary. Variance, I already told you that confidence interval and variance is directly proportional. So this is directly proportional. Look here, this is directly proportional. Confidence interval and variance. So if you increase the variance, confidence interval will increase. Sample size and confidence interval is inversely proportional. Okay, so if you increase the sample size, there will be decrease in confidence interval. Okay, hope this is clear. Okay, we'll go to the next question. Other points are not important, but what I want you to remember here is confidence interval and sample size is inversely proportional. More the sample size, less the confidence interval, narrower. Next question, guys. Next, can you answer the next question? A 52-year-old male having fever for 3 weeks. Okay, what is the clue here? Antibiotics, antimalarials, not useful. Abdominal distension and RK39 kit was positive. So what is the diagnosis? RK39 kit. RK39 kit is positive means what? Yes, it is Kala Azar. Okay, Kala Azar. Only 4 states that are endemic for Kala Azar in India. What are the 4 states? UP, Bihar, West Bengal and Jharkhand. These are the 4 states where Kala Azar is endemic. And what is the drug of choice? So it's common among children, patients present with hepatosplenomegaly. The investigation what we use in the program is RK39 days. RK39 kit was given. What is the drug of choice? Drug of choice. Yes, so we have to give answer is single dose of liposomal amphotericin B. Is a drug of choice. Liposomal amphotericin B. Amphotericin B. We have other drug is also available, miltefosine. Okay, other drug is also available. We have miltefosine, which is being used for where we use this miltefosine. PKDL, post-Kala Azar dermal leishmaniasis. It is being used. Okay, post-Kala Azar dermal leishmaniasis, we use this miltefosine. And what is the additional point here is that we want to eliminate Kala Azar, elimination. Okay, elimination is less than 1 case per 10,000 population at sub-district level. This is the criteria for elimination. Sub-district level, less than 1 case per 10,000 population. The criteria for elimination of Kala Azar in India. Fine. So these are the points. What is the vector for this? That you all know. Vector is what? Sandfly. Sandfly. That all of you know. Okay. We'll go to the next question. We'll go to the next question. Okay. Again a question from biostatistics. What is the answer here? Okay, fine. A study was conducted to assess the effect of a certain disease. P-value they have given. P-value of 95% confidence interval 0.02, 0.001. Okay, so which one is the interpretation? So two groups we have. What is the interpretation they are asking? Okay, fine. Look here. What is p-value? What is p-value? P-value means what is p-value? Probability of type 1 error. That is p-value. P-value means probability of type 1 error. Okay, what is type 1 error means? What is the probability of rejecting null hypothesis? Okay, you keep it, we don't have time, you keep this way. So you can say that type 1 error is false positive. Okay, false positive. So what is the chance of false positive? Fine. What is the chance of false positive? So we say that at what p-value the levels are significant. When the p-value is less than 0.05 means it is significant. So whenever you are doing a research, so next year once you become a PG, as a part of PG you may do some research. So in undergraduation time also you will do some research. So if p-value is less than 0.05 means it's a significant result. Okay, fine. Now, so if I have these two values, 4. Okay. So out of this, which one is significant, which one is not significant? So we have three values are there. Which one is significant, which one is not significant means the first one is not significant. Second one is significant because it's less than 0.05. Third one is more significant. Okay, that is also significant. Okay, but what is the additional point we have to say is that here lower the p-value. Okay, lower the p-value, more significant the result is. More significant the result. Okay, so p-value is lower the p-value, more significant the result is. Right? Now look into the question and answer me what is the answer here. Look into the question and tell me what is the answer here. Study B is more precise than study A and intervention Y is more significant than X. So with p-value you can't say precision and all, you can't say. So that means both these options are wrong. Both study is not significant, that is also wrong. Okay, fine. So what you can say is that X and Y are significant, but study B is more significant than the study A. Both are significant. 0.02 is also significant. 0.0001 is also significant. Okay, but study B, that is 0.001, is more significant. That is the interpretation, guys. Okay, we'll go to the next question, guys. What is this Nikshay Poshan Abhiyan? Few years back, I think 2-3 years back, this is an INI exam question. Nikshay Poshan Abhiyan. Okay, this is part of what? Which program? Yes, part of NTEP, National TB Elimination Program. So in that we are giving a nutrition allowance of 500 rupees per month during treatment. Okay, so we are giving this 500 rupees per month during treatment. NTEP, National TB Elimination Program. Our goal is to eliminate TB by 2025. So our goal is to eliminate TB by 2025. So for that we have taken lot of measures we have taken. Okay, so we are having this. So our goal is to bring down incidence. Okay, so reduction of incidence by 80%. So incidence reduction. Okay, by 80%. Okay, and TB deaths reduction by 90% and 0% out of pocket expenditure. Okay, 0% out of pocket expenditure. These are some of the goals. Okay, these are some of the goals of this, not goals. Okay, the targets we want to achieve. Ultimately we want to eliminate by 2025, guys. 2025. Okay, now, so recently also in NEET exam also there was a question was there. Whom do you call as a TB suspect? Anybody cough more than 2 weeks, fever more than 2 weeks, weight loss, and what else we have? Yes, hemoptysis or any abnormality in chest x-ray. If any one is there, you have to rule out TB, guys. Okay, any one is there, you have to rule out TB. So you collect 2 sputums. Okay, 2 sputum plus mandatorily you have to do chest x-ray now. Okay, mandatorily you have to do chest x-ray. 2 sputum smears you have to do. If sputum smear is positive, that means TB. Even if one is positive, means TB. Sputum smear is negative, both sputum is negative, chest x-ray looks positive. This is what the question in NEET exam. If both sputum is negative but x-ray looks positive, then what you are supposed to do? Then you should go for CB-NAT. Okay, CB-NAT. Okay, it will also tell you the rifampicin sensitivity also it will tell. If CB-NAT positive means it is a case of TB. It's a case of TB. Okay, if CB-NAT positive means a case of TB. And treatment wise what we have? Okay, treatment wise we have this dots. We have treatment, only one category we are going to have 2 HRZD plus 4 HRE. Isoniazid, rifampicin, pyrazinamide, ethambutol, and 4 months of continuation phase of isoniazid, rifampicin and ethambutol. Okay, fine. Now, next what else we have? Okay, so 99 dots. The monitoring system is called as 99 dots. That means you have to use your, the patient has to give their mobile number to us, and to that number, from that number he takes the tablets. The tablet backside there is this toll-free number will be there. So he has to give missed call from the number. That is 99 dots. And Nikshay Poshan Abhiyan also we give. What is Nikshay Poshan Abhiyan? Nikshay Poshan Abhiyan means, yes, we are giving nutrition allowance of 500 rupees per month during treatment time. Okay, so during 6 months we give that. Okay, fine. Now what other points we should know here? Okay, MDR XDR you should tell. That is simple. What is MDR? HR resistance. What is XDR? Okay, they should be MDR resistant to fluoroquinolones and kanamycin resistance to injectables, amikacin. Okay, kanamycin. Okay, these are MDR, guys. These are MDR. Let us see common things, guys. Okay, common things. So this is Nikshay Poshan Abhiyan is that. So you are providing during treatment time. Goal is to eliminate it by 2025. SDG is 2030 for TB, but our government says that we can eliminate by 2025. 10th question. Answer the question. This you should tell. Yes. So the pre-transfusion routine blood screening has been recommended in our country for all of the following conditions except. Okay, what is the answer here? Pre-transfusion. Yes. Yes. So our national blood policy, NACO says that national blood screening, this policy says that we should be screening for HIV. What other things? This is a simple question. HIV, HBV, HCV, syphilis, and malaria. So as per NACO, okay, National AIDS Control Organization, the answer here will be dengue, guys. Dengue. It's a simple question. Pre-transfusion screening policy in our country except is the dengue. Next question, guys. Okay, next question. Next. Regarding following color coded for STD, so what is the answer here? So this is syndromic approach, guys. We are discussing about syndromic approach. Okay, we are having syndromic approach. STD is very common, but we don't have enough facilities to diagnose it. So this model has been developed by WHO as well as our government. Okay, so any patient is coming with a particular STD syndrome, let's directly start the kits to them. So and in that context, they have renamed the clinic as Suraksha Clinic. Okay, STD clinic they renamed as Suraksha Clinic. Okay, fine. Okay, patient welfare clinic, Suraksha Clinic. So they say that. So what are the conditions we have? Urethral discharge. Okay, cervicitis. Okay, vaginitis. This is one category. Vaginal discharge is there. GUD. GUD means genital ulcer disease. Okay, next is also GUD, but penicillin allergic. Patient is penicillin allergic. Okay, again GUD. Okay, this is again GUD. This GUD is painful, herpetic, and lower abdominal pain. This is multiple times recently asked question, so you have to revise it, guys. Okay, fine. And inguinal buboes. Okay, fine. These are the various points we should know. Okay, various syndromes we have. So what is the color coding that is given available for this? So what are the various colors we have is, so for this one, gray color kit, vaginal discharge green. Okay, even this last INI NEET exam we had a question, GUD white, blue, red, yellow and black. Okay, fine. Now tell me what is the answer for this condition. Inguinal buboes is black. We'll check. We have to do the match the following. We'll see that. Fine. White color. Which one? Yes, white color we can go with. Okay, genital ulcer disease. Okay, gray color is this one. Green color, third. Yellow is lower abdominal pain. Fine. So what is the answer here? So A2, B1, C4. Okay, so answer is this one, guys. Fourth one, D is the answer. So this is clinic, Suraksha Clinic, and this is syndromic approach, guys. Fine. Okay. Next question. Which of the following nutrients will be required in lactating mothers more when compared to pregnant mothers? The question is, among this, which one is required more when compared to pregnant mothers? Okay, we will see as per the recommended daily allowance, we will see. Okay, fine. So we will take here first, we will come back to the question later on. Calcium, guys. Okay, calcium, if you take Pregnancy we have is 1000 milligram. So lactation you require more actually, 1200 milligram. So compared to pregnancy, lactation you require more calcium. Remember, iron is pregnancy 29 milligrams, and lactation it is 27 milligrams. So you require less, okay, in lactation compared to pregnancy. Vitamin A slightly more, 950 micrograms, and folic acid is less actually compared to pregnancy. Okay, so if you see this is required, more is required, less is required, this is more is required, and folic acid you require less actually, less. Okay, and iodine you require slightly more amount of, okay, so more you require. Okay, so compared to pregnancy, during lactation normally you require is 150 micrograms, during pregnancy you require 250 micrograms, and lactation you require 280 micrograms. Okay, fine. So when it is more, only three conditions we saw that: calcium, vitamin A, and iodine. Okay, iodine. Okay, but as such we don't take supplements for vitamin A and iodine, but calcium we may take. Okay, we'll go to the question. If the question says this, which of the following nutrients will be required in lactating mothers more? The question is more, the question says. So definitely calcium is more, iron is less, vitamin A is more it is required, folic acid is less. But the question, if it is given only one answer, okay, not multiple choice, multiple answer, if it is only one answer, okay, so the probable answer will go for calcium, the question. Okay, if it's multiple option wise means you can go for calcium and vitamin A. With vitamin A you don't take supplements and all, but calcium you will take as a supplement. Okay, fine. So if the question says only one answer, go for calcium. Multiple answer means calcium and vitamin A both are answers here. Fine. Next question, guys. Next question. Which of the following vaccines will be associated with intussusception? Okay, intussusception. So intussusception, I said that. So this answer for this question, yes. What is the answer? Yes. Answer is rotavirus, guys. Rotavirus. Okay, fine. Now, rotavirus, if you take rota, it can be given for maximum for 1 year. What is the schedule is 6, 10, 14 weeks. Okay, but the key point here is avoid first dose after 12 weeks. It can cause intussusception. The first dose you have to avoid it after 12 weeks, so it can cause intussusception. Okay, fine. Now, what other points we need to know? TSS, toxic shock syndrome. So MR vaccine used after 4 hours, you can get toxic shock syndrome. Toxic shock syndrome, MR vaccine. Okay, fine. What other points we need to know? Okay, it's fine. VAP, vaccine associated paralytic polio. This we call it as VAP. VAP is associated with which strain means it can come as a AEFI for OPV type 3. And second is VDPVs. Okay, vaccine derived polio virus. This can happen with OPV. Now this is because of type 2. VAP is type 3 and VDPV is because of type 2. And what else we have? We have this hypotonic, hyporesponsive episodes. Hypotonic, hyporesponsive, hypotonic episodes. Hypotonic and hyporesponsive episodes. This is associated with what? This is associated with DPT, persistent inconsolable screaming. Babies keep on crying. Okay, persistent inconsolable screaming. This is also associated with DPT, guys. Okay, DPT. The baby will be keep on crying for more than 1 hour. Okay, so more than 2 hours. Okay, the baby will be keep on crying. Okay, more than 3 hours actually. So that is persistent inconsolable screaming. That is AEFI of, okay, DPT, guys. DPT. And these are some of the points we should know regarding vaccines. Okay, fine. Next. What are the components of pentavalent vaccine? Okay, this is a straightforward question. Every exam will have this simple type of question. What is it? So pentavalent, it is DPT, hepatitis B, H influenza B. Okay, so diphtheria, pertussis, tetanus, hepatitis B, and H influenza B. Okay, so this is sometimes this is a bacterial condition. Remember that. Okay, there was one question was there. Okay, so whether influenza, will it prevent influenza or not? Means no. Influenza is flu. So will it prevent flu? Means no. That is a separate vaccine. We don't give it in the national immunization schedule. It's a bacterial condition. Okay, diphtheria, hepatitis B, and H influenza B. Maximum it can be given for 1 year, and it is a freeze-dried vaccine. It's a freeze-dried vaccine. Okay, fine. Okay. Concept-based question, guys. Okay, answer the next question. Fine. The effects of pulse oximeter readings in neonates with and without using micropore was studied. What is this graph, guys? What is this graph? First of all, what is this graph? So this graph is called as scatter plot. This graph is called as scatter plot. Fine. So what is this scatter plot? Where it is used? The scatter plot is used for purpose is for correlation. Purpose is it is used for correlation. What does correlation will tell us? Correlation will tell us strength and direction of relationship. Direction of relationship, strength and direction. Direction of relationship between two quantitative variables. It will tell you the strength and direction of relationship. Okay, age and body weight you take it. Okay, age and blood pressure. Okay, so strength and direction of relationship between two quantitative variables. It is expressed by correlation coefficient. It is expressed by correlation coefficient, that is small r. So correlation, it's expressed by this correlation coefficient small r. So what is this? R ranges from -1 to +1, guys. R ranges from -1 to +1. So what type of correlation is it? Look at the picture and tell. Okay, so you are plotting this. Okay, so two variables are there. If one variable is increasing, the other variable is increasing. So this is what? This is positive correlation. This is positive correlation. One variable if I increase, the other variable is also increasing, means positive correlation. Okay, suppose I will take the example as age and forced expiratory volume, FEV. Age and forced expiratory volume. Age and forced expiratory volume. If I increase one variable, the other variable decreases. Okay, the other variable decreases. Okay, then it becomes what? It becomes negative correlation. One variable increases, other variable increases means positive. The other variable decreases means it is negative correlation. Okay, fine. What is the answer now? Okay, what is the answer to this question? Look here, we'll go one by one. There is a positive correlation with constant 3% increase in y-axis value. We can't say percentage and all. Okay, so that is wrong. Okay, there is a constant negative correlation. This is wrong. Okay, there is increasing. If I increase one variable, the other variable is increasing. This is a positive correlation. This is right, and there is no correlation. That is wrong here. This is correlation. The graph is scatter plot. Scatter plot. Next question, guys. Okay, fine. The following item needed to be discarded in a black bin. Okay, the following item needed to be discarded in black bin. Black bin is what? We are discussing biomedical waste. Is it a biomedical waste bin? What are the color bin we have is red, yellow, blue and white. Okay, fine. These are the color bins. But the question is black bin. So black bin probably it's a general waste. So where we can put this colored bin, black bin? Paper and wrapper of the gloves, guys. Okay, paper and wrapper of the gloves. This is the general waste. So recently asked questions alone we will see. Okay, recently asked question in each bin. Okay, so red color recently asked is gloves, guys. Gloves, recently asked question. Yellow recently asked blood bags. Okay, blood bags. Okay, fine. Then we have this chemical waste recently asked, and we have this pharmaceutical waste. Okay, expired drugs actually. Fine. Blue color bin. What comes in blue color bin? Blue color bins, vials. Okay, vaccines. And recently asked one is pacemaker. Okay, pacemaker. It comes in metallic body implants, that comes here. Okay, fine. White color bins, what you will recently sharps, guys. Sharps, needles, blades, all these things will come. Okay, so contaminated gloves, red color, linen, mattress, all will go to yellow color. Okay, gloves, it goes to red color. Fine. Next. Next question. This is a criteria they asked regarding essential drug. It's there in textbook of Park itself. It was asked in INI exam 1 or 2 years back. Okay, fine. Which of the following is not included, okay, in the criteria for the essential drug? Every country, our country, regularly list out the what are the drugs, essential drug list, and what is the criteria for the essential drug list they releases. Okay, fine. Now, so we will see one by one, then we will come back to this question, guys. Fine. So whichever drug that is in that essential drug list, it has to be approved. It has to be approved and licensed in India. That is right. It should be the whatever disease of public health important, the drug has to be there. So proven safety has to be there, efficacy has to be there, cost effective. So it should be aligned in the current treatment guidelines. Whatever drug we are including in the essential drug list, it should fulfill all these criteria. Fine. So it should be stable. Okay, so when more than one medicine is available, one prototype drug will be taken. So multiple drug means, so out of this one prototype drug will be included in the list. Okay, fine. Next is usually FDC, fixed dose combinations are not included. Paracetamol with aceclofenac. Okay, usually the common drug. So that comes in, that is not part of this essential drug. The key point here is that fixed dose combinations. Okay, unless it shows some advantage. Okay, usually the essential drug list does not include FDCs, fixed dose combinations. Okay, fine. Now we'll go back to the question you answer statement wise. So which is not included? Clinical trials, proven efficacy should be there, cost effective, current treatment. So FDC combination is better than the individual drugs. The answer for this question is FDC is better than the individual drugs. This is wrong here. Okay, fine. All others are right here, right. Answer the next question, please. Answer the next question. Considering the causes of death of 1 to 4-year-old children in India, the correct sequential arrangement will be. What will be the current sequential arrangement? Yes. Now we will take different age groups. We will take. Okay, fine. For neonatal, infant, under 5. What is the most common cause of death here? For this age group, neonatal period, infant mortality, under 5 mortality. For all these, the most common cause is low birth weight or prematurity. low birth weight or prematurity. Late neonatal period, late neonatal, post neonatal, okay, 1 to 4 years. All these age group 1 to 4 years. 1 to 4 years. For these age group, the most common cause is, what is it? Diarrhea followed by respiratory infections. Okay, diarrhea followed by respiratory infection. Soiled gloves also you should go to red color bin. Okay, so anyway we are going to disinfect it. Soiled it should go to red color bin, guys. Fine. So late neonatal, post neonatal, 1 to 4 years. For all these things it is diarrhea followed by pneumonia. Okay, fine. So what is the answer here? First is this one, guys. First is diarrhea. Okay, first is diarrhea. Okay, 1. Okay, so answer is this one. Okay, fine. Diarrhea, pneumonia. Then nowadays injury has increased, then followed by malaria, guys. Okay, it is malaria. First is diarrhea. Fine. Diarrhea comes first, not pneumonia. Next. Some additional points here. We have this health status. Which indicator gives health status? Health status of community. Health status of community, infant mortality rate and pregnancy wastage. This was this year NEET question. Pregnancy wastage, it is perinatal mortality rate. Perinatal mortality rate. And what is the other one? Social indicator for social development and well-being. Social development and well-being. Okay, that is under 5 mortality rate. Under 5 mortality rate. So this year NEET question we have this health status. Okay, so infant mortality rate, that is health status. Pregnancy wastage, perinatal mortality, social development and well-being is under 5 mortality, guys. Under 5. Next question. Go to the next question. A patient has been diagnosed to have TB and HIV. What is the treatment protocol? Okay, so diagnosing TB and HIV co-infection. So what is the treatment protocol? Yes. So you have to start ATT, anti-TB treatment, after 2 weeks. Okay, after 2 weeks. Okay, after 2 weeks start ART. Okay, start ART. Okay, so anti-TB then followed by ART. Okay, fine. Now, if you do this way, the answer is this one. But if you do this way, first ART, then if you go for ATT, it can go for IRIS. What is IRIS? Immune reconstitution inflammation syndrome. Immune reconstitution inflammatory syndrome. Okay, immune reconstitution inflammatory syndrome. So now what is the guideline for TB treatment, HIV treatment? If anybody is positive for HIV, okay, so we suspect means we have to send them for where ICTC we have to send, where they will undergo pre-test counseling, testing, post-test counseling. After that they will undergo, they will take positive means they will go to ART centers. In ART centers, what is the current guidelines for treatment? Okay, start immediately lifelong treatment. Immediately. Okay, you have to start them lifelong treatment. So what are the drugs available? So TLD, tenofovir plus lamivudine plus dolutegravir. So we have to start them on dolutegravir. Okay, Okay, tenofovir, lamivudine and dolutegravir, lifelong ART, lifelong, immediately. So PPT-CT are mother to child transmission. So prevention of mother, MTCT means mother to child transmission. So mother to child transmission, same principle. Immediately you have to start, immediate, as soon as mother is confirmed, same drug, lifelong ART, TLD, tenofovir, lamivudine and dolutegravir. Okay. And dolutegravir, plus you have to give nevirapine syrup for the baby. Okay, nevirapine syrup for the baby. Okay, this you are going to give. This is mother to child. Okay, post exposure prophylaxis. Okay, following any needle stick injury. Okay, so any injury you have. Okay, during internship people will come. Okay, PG period people will come recapping of needles. So at the time the current guideline says that you can start with the raltegravir, okay, and tenofovir, plus you can give dolutegravir, emtricitabine. Okay, so tenofovir, raltegravir plus emtricitabine. Okay, so now dolutegravir combination also is coming. Okay, fine. So now how long you have to give for post exposure prophylaxis means 4 weeks you have to do. You can remember tenofovir, emtricitabine you can give, and the raltegravir you can give. Okay, fine. Go to the next question, guys. Okay, we'll go to the next question. Regarding Gangaru mother care, which are the following will be the features? So this Gangaru mother care, this concept was done to improve survival of low birth weight babies, guys. To improve the survival of low birth weight babies. Okay, so it started from Colombia. So if you keep the baby in NICU itself, the baby will be having a more chance of infection. Okay, so you put the baby on mother's chest. Okay, mother's chest. So this skin to skin contact, exclusive breastfeeding, early discharge. Okay, fine. If you do this, automatically weight gain of the baby will be there. Okay, they require four components: skin to skin positioning, exclusive breastfeeding, early discharge. Okay, and fourth component, support in the community by health workers. Support in the community by health workers. Okay, fine. So you focus on this. Okay, skin to skin positioning. Okay, exclusive breastfeed, nothing else. You need not to do anything. Automatically weight gain, early discharge, support in the community. Nowadays home based newborn care we give. Okay, ASHA goes. What is the number of visits for ASHA? What is the number of visits for ASHA, home based newborn care? Okay, for a normal delivery, ASHA has to go for 6 visits. Okay, now LSES 5 visits. Home delivery 7 visits. Okay, home delivery 7 visits. So HB, home based newborn care. Okay, this many visits they have to make. Home based care of young children is there. Home based care of young children, that is also there. So you have to the ASHA is going there on these months they have to go. So 3 months, this is months actually. 5 visits she has to make, 3, 6, 9, 12 and 15 months she has to visit. So 5 visits she has to make. Okay, home based care for young children. Okay, fine. So 3, 6, 9, 12 and 15 months she has to visit. Home based newborn care she has to make, normally it is 6 visits. 6 visits she has to make. Next is a simple question. According to the definition of triage, there will be categorization of disaster. Okay, so following disaster, that is impact. After this, what you will get? Following impact you will get, what is the next phase? Response phase. Then you have this relief phase will be there. In response phase, what we are going to do? You are going to do search, rescue and first aid you are going to do. That was the question. So at that time, what you are going to do? So you are going to focus on triage, guys. Okay, triage. What is triage? Triage, injured people, classifying people injured people based on their chance of survival. Okay, classifying injured people based on their chance of survival. So chance of survival. So what are the color you are going to have? Red means the patient is high priority. Yellow means medium priority. Okay. Green means ambulatory. And black means dead persons. Okay. Moribund or dead. NEET, this year NEET also we had a question from this. Okay. Red means high priority. So yellow medium, green ambulatory, black is dead. So what is the answer here? What is the answer? It is based on their chance of injury and likelihood of survival, guys. Okay, fine. Likelihood of survival. So am I clear? Yes. We'll go to the next question, guys. We'll go to the next question. It's a repeated question. So a few years back, this is an INI exam question. What is the treatment of falciparum cases in northeastern states? Usually the resistance for malaria starts in the northeastern states. Okay. Suppose it's a case of Vivax. Okay, so Vivax means it is chloroquine, guys. Okay, chloroquine plus primaquine. This is for Vivax. This is Plasmodium falciparum. Normally you have this ACT for 3 days. And primaquine you are going to provide. Okay, so ACT means artesunate, sulfadoxine and pyrimethamine. This is falciparum. Now, the question is very specifically. So, key point here, for falciparum, do not give chloroquine because the falciparum has become resistant to chloroquine. Okay, so do not give chloroquine. So, if the question is very specifically, if they ask you northeastern states, then usually the resistance starts from there. And for northeastern states, so the answer is artemether plus lumefantrine, guys. The answer is artemether plus lumefantrine. Okay, fine. Now, so am I clear? It's artemether plus lumefantrine. That is the drug we are going to use. If it's a mixed infection in any other place, mixed infection. Okay, so you have to give ACT plus primaquine. Primaquine you have to give, Vivax is there, you have to give 14 days. Normally you can give 7. Normally for falciparum you can give 1 day, but Vivax is there means 14 days. What about pregnancy? Pregnancy and falciparum. Vivax means you can give just chloroquine. Okay, primaquine is contraindicated, don't give it. But if it is a falciparum, you have to give AC first trimester. If it's a first trimester, give quinine. ACT is contraindicated in first trimester. Second and third trimester you can give ACT, but primaquine is contraindicated. Don't give primaquine, guys. Don't give primaquine. So am I clear? So these are the points we should know regarding the treatment of malaria, guys. Malaria. Next question. In a patient with PNH, the CD markers, flow cytometry was immunohistochemistry was used. So plotted means, okay, these are what data, these are graphs they are asking. So we are having some graphs. So these graphs this data is quantitative data. Quantitative means we can measure it. The markers we can measure it. So which graph will be ideal? The answer is histogram and dot plot, guys. Histogram and dot plot. Okay, look here. This is pie chart qualitative data. Bar chart qualitative data. Line diagram means you require time. Time is required for line diagram. So those things we can't take it. The pie chart qualitative data, bar chart qualitative, line diagram means time. So this is the picture of this, what is this? Dot plot. So for every values, how many members are there? Okay. So this is where it is used. This is used for quantitative data with less sample size. Okay, this is used quantitative data with less sample size we use. Okay, this is dot plot. Okay, fine. The next one, look here, this is histogram. Look here, this is serum cholesterol, it is measurable. So this is quantitative data. So compared to bar chart, what will not be there? No space. Okay, if you look into bar chart, there is no bar chart will have space will be there. But compared to bar chart, this one will not have any space. This is quantitative data, guys. Fine. What is this graph? This is line diagram. So line diagram, we have time is there. Time. So time is there in the x-axis. So line diagram, time is there. So this will tell you trend of the event over a period of time. This will tell you the trend of the event over a period of time. This is line diagram. What is the trend of this condition over a period of time? This is line diagram, guys. Line diagram. What is this graph? I already told you. Yes, this is causes of. This is qualitative data. Qualitative means not measurable, only countable. Okay, so each maternal malnutrition, how many people? Lack of antenatal care, how many people? So there will be space will be there. This is simple bar chart. So space between the bars. Space between the bars. There will be space will be there between the bars. Okay, fine. This is simple bar chart. Okay, qualitative data, space will be there between the bars, guys. Fine. Okay, so am I clear? Yes, these are the various graphs. At least we should know, have an idea. The spikes protocol. Okay, where it is used. Yes, can anyone tell me? This was as few years back in INI exam. Spikes is used for breaking bad news, guys. Okay, this is what the spikes is meant for. This is spike stands for, okay, this acronym we use. So if you want to teach, actually we teach this for the MBBS students nowadays. Okay, we have this new curriculum, CBME curriculum. This new curriculum we teach them, students, they want to how to tell a bad news to the patient. Okay, you want to tell the patient is having a terminal illness. Okay, they have to do amputation, something. So how to tell that? Okay, so it's a form of communication. Okay, for communication we have this new module called as AdCom. In that module we teach them, okay, spikes approach, setting, okay, check their perspective. Invitation means, okay, you invite questions from them, check their knowledge. With empathetically you have to summarize it. So the question probably they will ask is spikes is for what? So recently we are getting some other questions also. It's a medical education point of view. What are the domains of learning? So we have these various learning domains are there. One is cognitive. Cognitive domain means we focus on knowledge. Okay, knowledge domain. Okay, so knowledge domain is cognitive. Second is psychomotor domain. Psychomotor is skill based. I'll give you an example. Okay, skill. Focus on skill. Third is affective domain. Affective domain focuses on values. So ethics. Okay, it focuses on values, teaching values to students, ethics and communication. All these things will come in affective domain. Okay, so these are the various domains we have. Okay, suppose for a student, so we have a student. So for a student, I am taking a lecture. At the end of the lecture, I am asking, tell me 5 causes of hepatosplenomegaly in India. If I ask this question, what domain I am checking? I am checking Yes, I'm checking this cognitive domain, knowledge I'm checking. Okay, fine. So second one, I'm asking a student, okay, so demonstrate how to do a percussion or how to check blood pressure in a patient. You show it to me, I'm asking. So what I'm checking here, even though for that knowledge is required, but what I'm checking here is I'm checking the psychomotor domain. I'm checking the psychomotor, that is skills, whether you can able to do it or not. Okay, fine. So intern, I am asking intern, okay, you communicate, suppose in my OPD, interns are there. I'm asking him, okay, you tell, counsel this patient on a diet. Okay, so our lifestyle modification. Okay, I ask him to do that. Okay, so which domain I'm checking? Yes, I'm looking for affective domain. So we had a question on hand washing. Hand washing will come in which domain? Hand washing will come in, yes, psychomotor skills, guys. Okay, so you're teaching people how to wash their hands. Okay, which finger to first. Okay, so that steps of hand washing you are checking. That comes in psychomotor domain. Okay, psychomotor domain, you require cognition also, but you are checking the skill directly. This is the last question. Remaining things we'll see tomorrow, guys. Tomorrow. In a patient with lead poisoning, which are the following will be most common pathway of absorption of inorganic lead? Okay, so inorganic lead they ask. This is a lead poisoning. So common among battery industry. Okay, common among battery industry. Okay, so glass industry, ship industry, these are the areas are common. Okay, fine. So we have these two types of lead is there, organic and inorganic. Inorganic lead is inhalation, guys, inhalation. So organic lead is, what is the root of organic? Is organic is skin absorption. Organic is skin absorption. So inorganic is inhalation. So what are the symptoms the person may show? Okay, what are the symptoms? Patient will have abdominal pain, will have, okay, constipation will have. Okay, so what is the blue line in that gums? Wrist drop. Okay, patient will have foot drop, they will have, and this Burtonian line they will have. Burtonian line, blue line in the gums. So when all these things will appear, when the blood lead levels, when the blood lead levels are more than 70 microgram per deciliter, these symptoms will appear. Okay, 70 micrograms. Okay, so at that time the symptoms will appear. Okay, so you can go with urine examination. You can look for CPU, coproporphyrin. You can check coproporphyrin. You can check ALA, libulinic acid. You can check elevated levels. You can find in the urine, guys. Urine. Fine. So in pneumoconiosis, some additional points we can see. What are the points in pneumoconiosis we can see is byssinosis is associated with what? Cotton fibers. Bagasosis with what? Sugarcane dust. Sugarcane dust. Silicosis, so apical lobes it will affect. Silicosis, it will affect the apical lobes. Apical lobes. The X-ray will show snowstorm appearance. Snowstorm appearance. They are more prone for TB. They are more prone for TB. Silicosis. And the next one is asbestosis. Lower lobes. Lower lobes. Ground glass appearance. Lower lobes, ground glass appearance will be there. So they are prone for this mesothelioma. This here NEET question. Okay, mesothelioma. Okay, fine. So am I clear? So we have seen some 25 questions we have seen. So I can send this PDF in the group, okay, in the Telegram group. Please put your queries. We will continue the remaining questions. Okay, remaining areas we'll have. So tomorrow we'll discuss around 25-30 questions we can discuss. Okay, fine. Thanks for listening. Okay, we'll see. You can access our YouTube channel. We have Facebook groups. We have, okay, Instagram. You can access us. Okay, Telegram channel is there. Okay, so kindly join us. Put your queries, anything in the chat box. Okay, so in your comment section. Okay, thanks for listening. We'll see you tomorrow, guys. Okay, thank you.